Welcome to my presentation on repetitive transcranial magnetic stimulation rTMS treatment for major depression disorder. The presentation will explain depression mechanism followed by rTMS brain effects and its proven benefits and conclude with research boundaries and upcoming studies. The major depression disorder is stand as a major disability factor which affects millions of people around the world and diminishes their life quality. Our research shows that 1 in 5 people experience major depression in their lifetime. The traditional antidepressant and psychotherapy treatment failed to develop numerous patients which demonstrate the necessity for new treatment options. The data shows 30 to 40% patients do not respond well with the traditional response. rTMS, non-invasive neuromodulation technique, places a magnetic coil against the scalp to deliver its treatment that triggers cortical activities. In this presentation, we will focus on the mechanism, efficacy, and future research. Psychological mechanism of MDD. The prefrontal circuit system experience disruption during depression. The dorsolateral prefrontal cortex (DLPFC) demonstrates decreased activity during depression. The amygdala function at an elevated level because it handles negative emotional process. The body becomes more sensitive to stress because of HPA axis dysfunction, which creates an imbalance between the hypothalamic pituitary adrenal system. The brain shows decreased neuroplasticity because depression also leads to a lower BDNF production and synaptic growth problems that prevent brain adaptation and recovery. Psychological effects of rTMS. The left DLPFC receive high frequency stimulation that leads to increased activity level, which results are excitatory effects. The right DLFC receive lower frequency stimulation, which creates inhibitory effects that decrease excessive activity. The treatment method of rTMS leads to increased brain activity and synaptic plasticity through its mechanism. The treatment leads to a higher BDNF production and stimulate new brain cell growth and control um, cytokine activity to decrease inflammation. The combination of these changes leads to a better equilibrium uh, between prefrontal and limbic brain areas. Evidence of efficacy. Multiple clinical trials have proven that rTMS provides significant antidepressant effects in patients. The research conducted by Chen and his colleague in 2009 shows that patients experience better outcome in their depressive symptom and anxiety symptom. Another study demonstrated that the 3D trial that rTMS effective treatment anxiety symptoms in patients with depression. Another research conducted by Mirman and his colleague in 2022 established that patients who experience positive mood changes during their first week of rTMS treatment achieve better overall treatment outcome. Another research conducted and shows that patients achieve response and remission at rate between 30 to 50%, although individual results differ from one patient to another patient. Critical view of mechanism. The research conducted by Dalhousen and his colleague in 2021 showed that rTMS treatment leads to neuroplastic changes in both hippocampal and cortical brain region. Biomarker researchers shows conflicting results between different studies produce different outcome. In 2017, one study shows that neurophysiologic measure as potential biomarker, yet Boileau and his colleague 2024 discovered that biomarker changes did not constantly predict cognitive improvement. The treatment of rTMS generate dual effect on brain structure through cortical thickness measure and molecular changes involving BDNF and sciatic levels. The disorder complex nature makes it difficult to translate research discovery into reliable clinic treatment result. Prognostic factors and limitation. Another research in 2004 established that patients with brief depressive episodes achieved better results from rTMS. The study conducted by Volkanen and his colleague 2018 showed that patients receive same treatment experience notable improvement, which indicate a powerful placebo response in this treatment approach. The 2023 research by Abo Anu and colleagues established that treatment success depends on three main factors, which include patient age and their initial condition and their current um, medication status. The 2024 study shows that the bilateral accelerated protocols presents tolerance problem because neuro patients fail to maintain the elevated intensity session. Future research and direction. Future studies should develop biomarker-based treatment method which enables doctors to create individualized stimulation plan based on patients' biological characters. The optimization of treatment parameters include frequency and intensity and stimulation site location requires further investigation. The combination of rTMS with pharmacological and psychotherapeutic intervention shows promise to improve its treatment outcome. The development of sustained method for preventing treatment success and stopping depression relapse require immediate attention. Research needs to investigate the reason behind individual patients' response difference to achieve precious psychiatry. In conclusion, rTMS as an effective, safe treatment for treatment-resistant MDMM. The treatment mechanism of rDMS involves three main actions, which include promoting neuroplasticity and balancing brain network and controlling biomarker. The result from rTMS treatment shows variability between patients, while placebo effect make it difficult to understand the actual treatment outcome. Future medical approaches will use biomarker to create personalized treatment plans, which will deliver the most suitable protocol for each patient. And in this page, I am including the reference list. Thank you.